Okay, just to let you guys know, we are going to stream live on Facebook. And I just ask that you please raise your hand once we are done with the press conference, and we can certainly start with questions. And I will call on you, and then you can turn on your video and unmute yourself to ask your questions.
Hi, Shannon.
Hi, Eric. Dr. DeLucia, do you mind turning on your video, please?
Not at all.
Okay, perfect. All right, we're going to get started in just a moment. We do have media that are on. I just have hidden all those with their videos off. So that's why you cannot see them. They are also going to be asking questions at the end. So we are going to go ahead and get started in just a minute. Eric, are you good to go?
Yeah, can you give me 1 second?
Sure.
If you would, please. Thanks.
Are there any questions in the interim from our friends at the media before we get started? No? Okay, great. I'm still here, no worries. Don't freak out. Just turned off my video. Okay.
Shannon, whenever you're ready. Yeah, I
Sure.
apologize.
No worries. Okay. Good afternoon, and thank you all for being a part of the Toledo-Lucas County Health Department's COVID-19 virtual updates. We have the Health Commissioner of the Toledo-Lucas County Health Department, Dr. Eric Skidzinski, along with pediatrician Dr. Jennifer DeLucia, to give us our updates on COVID-19 within our community. I'm going to go ahead and turn it over to Dr. Skidzinski to kick it off.
Thank you, Shannon. Good afternoon, everybody. Wanted to make sure that we got in front of the community today to talk about the current status of COVID in our community. I think we're all hearing about the issues throughout the country right now about elevated COVID cases, how hospitals are having to handle them right now, and kind of where we think we might be headed here in the future. So let me start off, Shannon, if you don't mind. Let's start off by some of the current data. Thanks.
Okay, sure thing.
So our vaccines that are started, we're not doing too bad. 51.45%, completely completed, if you would, 47.62. This has really climbed up over the last couple of weeks, percentage-wise. So that is good to hear and good to see. The problem is, we want to reach that magical number of 70, so we continue to work towards that. There's many things that an increase in or a high level of vaccinated individuals in a community will do for them. As we know, the majority, well over 90% of those that are being admitted into hospitals are those that are unvaccinated, those with severe symptoms. But if you were able to listen to the Ohio Department of Health press conference today, again, like we talked about here before, the reason why we want to get more people vaccinated is that it helps knock down future mutations, which could pose even a more of a threat to us in our community. So there's a multitude of good reasons why to get vaccinated. Again, we are stressing to get vaccinated. It is the main tool right now to keep people out of the hospitals, to keep our hospitals operating appropriately. And the way that we do that is, again, that vaccination, and we continue to hold vaccination clinics throughout the community. You can get on our website and look where we're at every day. We usually try to take Mondays off if we can, just to give our staff some rest. But again, we are definitely out and about in the community in different areas. So please, 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 if you have not gotten vaccinated yet, it really is important that you go ahead and get vaccinated. Next slide, Shannon. So what do our numbers look like? This is what I see on a daily basis when I walk in the morning. our current levels. These are caseloads every day of new infections that we have in our community. And if you can take a look, you look back in 8-10, look where we're at, about 59, 78 cases. You can definitely see at the beginning of September, we've jumped well over that number, into the upper hundreds, 187, 176. Now we've seen a little bit of downturn, but this is expected. We do see this. We would love to see this continue, this downward slope. But again, I don't think that we're going to see that. Let's keep our fingers crossed and see if we could do that. But the conditions that are around us and inside of our community really don't point towards that. So again, vaccinations are important. Next slide, Shannon. So as we go through all of our data crunching on a daily basis, we try to pick out things that are going to help our community understand what's going on. And I really need to say that there are two things, like I've said before, two things that I'm very concerned with in our community. One is our hospitals and how they're going to be affected by increased numbers of COVID patients inside of those facilities. We'll talk about that here in a second. But I think the bigger one right now really is this concern about kids getting COVID. We know that kids can get COVID. We kind of saw that with the first variant, but this is something a little bit different. We're seeing more kids at this point in time present as COVID positive. If you notice back in the end of July, we had 52 cases, and kind of look how they're stratified there. As we move into the first part of August to, let's say, the later half of August, you see that one up. But if you look over the last 2 weeks or so, take a look at the number of cases. It's significantly more positive kids within inside of our community. Why is that such a concern? Again, these kids, we are seeing them present to the hospitals in small numbers right now in Lucas County. Other areas within inside of our state, they're seeing increased numbers of kids being presented into their facilities, much more than what we're seeing. The hospitals right now, just to give you some numbers, again, I think it's important that we talk about a little bit of numbers. So at if you look at, August 9th, we had 55 admits to our local hospitals. As of September 9th, it's 181. So you definitely have seen this increase in numbers of admits of positive patients. This is across the age spectrum, please. And we'll talk about the pediatric cases at the end here. ICU beds. Back on August 9th, we had about 24 in use. As of the 9th of September, we had 50. If we look at ICE vent use, back on the 9th of August, we had 10. September 9th, 17 use. A couple of days ago, the high over that time period was about 22. And that was, I think, 3 days ago when we had 22 vent use. So we do expect these numbers to oscillate and move around. But what we're definitely seeing is this increase in cases of COVID being admitted to hospitals. And I think more indicative of a concern is ICU bed use, over vent really, ICU bed use, because that's telling us that this is getting more aggressive in the symptoms and severity. So again, all this combined is really guiding us of where we might see things go. But more importantly, these are hospitals, again, they are fantastic institutions, just brave men and women working there, but they're inundated. Staffing is low. We could have 1,000 vent uses, but if we don't have enough of people to actually monitor and operate those vents for those people who are using them, it doesn't really matter. So that there is this issue of us starting to inundate our hospitals and inundating that staff there, which we really have to be cognizant of. We have to make sure that we do everything as a community to help these hospitals out so that we can have our mom and dads who might have a heart attack go to the hospital and get good care. we're seeing across the nation that some states are looking at, we're just going to call it alternate standards of care. It's different type of care than what you would normally see, because again, they have to ration that care for whatever reason. We're not there here in Lucas County. Could we get there? Of course. But our job is to make sure that we don't get there. And again, vaccination, wearing your face covering, making sure you wash your hands, trying to stay away from people. We're not saying don't live your life, but we can do some things to help the hospitals out. I mentioned children, and I'm glad we have a doctor here today who is just fantastic, and I really appreciate her being on today. But let's look at the kids right now. Who are being hospitalized. We don't have a lot of kids right now who have been admitted, let's say. Over the last 4 days or so, the numbers that we have are about 5 or so patients who are pediatric patients who've been admitted for COVID inside of the hospital. That on itself, to me, it's concerning. Anytime we get kids sick, it kind of tears at my heartstrings. But if we look back over the last 30 days, 60 days, we might have had 1 or 2 days where we had kids being admitted. We've never had a string of 4 or 5 days where we've seen admits of children. And so we need to continue to watch that and see where that takes us to really gauge, the severity of the concern on our kids who are being admitted to the hospitals. So Shannon, that is my update. I don't know where we want to take it from here. I don't know if you have any other PowerPoints that we need to share, but I'm going to turn it back over to you.
Okay, thanks so much, Eric. Dr. DeLucia, who is a pediatrician, is going to give an update as to what we are seeing here in Lucas County from a medical's perspective, what the providers are seeing in the hospitals, what the pediatricians are seeing in their clinics, some recommendations, and what we can do to protect our kids moving forward. So Dr. DeLucia, please go ahead.
Thanks, Shannon. Okay, the main thing that we are seeing right now is that there are more children sick with COVID and getting hospitalized in our area locally than we have had at any other time during this pandemic. This is really concerning. You're seeing on the news that in Louisiana and Texas and other places that have low vaccination rates, you are seeing a record number of kids admitted. And although our hospitals in town, Toledo Children's and Mercy Children's, don't release the actual numbers of COVID patients that they have. That's their policy from both places. They won't tell you exactly. We do know that 77.1% of PEDS ICU beds are currently occupied. And that's an unusual figure for a pediatric intensive care unit. The other thing is that right now, most pediatricians are seeing in their offices and in the hospitals 3 main viruses that are circulating. Enteroviruses, that's a really common thing in the fall. But respiratory syncytial virus is on the rise. It really started in August, and generally that is a cold weather virus. You see that between November and April. So it's really unusual to have respiratory syncytial virus at this time of year. And lastly, they're seeing COVID. Now, here's the really scary part for me is that some of the very sickest patients in the ICU right now have a co-infection of COVID-19 with respiratory syncytial virus. And that is something we have never, ever seen before. The other thing that we need to know here is that there has been an 80% jump in hospitalized pediatric cases nationwide. And we're seeing some of that here as well. I want to touch on how do we protect kids because, right, we have Pfizer for ages 12 to 17. And by the way, in unvaccinated children of that age, their chance of being hospitalized is 10 times the rate of vaccinated children ages 12 and over. So that right there shows you how effective the vaccines are even in this age group. But we are seeing that in states that have low vaccination rates, even just counties that have low vaccination rates, we're seeing 4 times the amount of pediatric admissions that we are in other places. Whereas conversely, states that have very high vaccination rates, we are not seeing this pediatric surge in admissions. So what can we do to protect kids? The number one is anyone that is eligible needs to be vaccinated. because, you know, we're a community. And every time an adult, even if it's an adult that doesn't knowingly have contact with children, every time an adult gets vaccinated, that's one more person removed from that chain of transmission. You do see much lower rates of COVID and the Delta variant as well, of course, because that's 99% of our COVID cases in the US right now. You see much lower rates of infection in the community if there's a high vaccination rate. So vaccination is number one. Number two is masks. I know I have seen people wearing signs saying masks don't do anything, but there was just recently a published study out of Bangladesh, and they looked at masks and the effectiveness of controlling COVID-19 pandemic with it. And they looked at people that don't wear masks, people that wore cotton masks, and people that wore surgical masks. And there was absolutely no doubt that surgical masks themselves are very highly effective in preventing the spread of COVID-19. Tony Fauci, actually, I just attended a seminar virtually of his, and he is calling for mask mandates in all schools in the country. And I think that that would be a huge way to protect our children, even our children who are not old enough yet to be vaccinated. And we need to layer protection. So vaccines and masks, we need to layer with social distancing, and we need to layer that with improved ventilation systems. And if there's not a good ventilation system in the classroom, open a window, any ventilation that we can get in, or take a class outside if the weather's good. That makes a huge, huge difference in protecting our children. I think those are the main things I wanted to say today.
Doctor, thank you. And you know, I cannot echo those more than what you just stated. The idea here is to, again, keep these kids safe. And I will tell you that, you know, our schools are trying to do everything they possibly can to keep the kids safe. But again, we know they really do need to be in school. And so they are dealing with so many different things coming at them at one time. You know, our jobs are hard in the medical and health field. Their jobs are just as hard in that educational arena, trying to keep the kids safe, getting them educated, and making sure that, again, socially, they have that ability to interact, which is so, so important. So again, kudos to our schools in Lucas County for everything that they're trying to do and doing the best they can. Shannon, I do believe that is it.
All right, let's turn it over to our friends at the media. We are going to go ahead now and take questions. The first question comes from Melissa Veitch with WTVG. Melissa, go ahead and ask your question.
Yes, hello. You know, Eric, I want to direct this question to you. We often look at modeling for our ability to kind of determine what's going to happen in the future. I know the health departments do. What does that show as far as the path of COVID in our area?
You know, Mel, great question. Modeling is only as good as, you know, kind of what's put into it. We saw early on the modeling didn't really hold up to what was occurring early on in the pandemic. The modeling that we're seeing now is probably a little bit better, but it all depends on which model you look at. There's the most severe model where, you know, we could be looking at the peak towards the end of October, which would be twofold, really what we saw early on in the pandemic. But again, it all depends on what variables are in there. And some of the modeling has even, you know, taken us below where we're at already. I think what we're looking at, and I'm just going to kind of use the admits to hospitals and some of the modeling that I've seen there. That means that we're still on this upward threshold. Actually, it's at the upper modeling for numbers. It's actually in Lucas County following that. I don't know. Again, I just be guessing on the exact number, but we're going to continue to rise here till probably at least middle of October, towards the end of October, just from what we're seeing in the model, but also then kind of what we're seeing on the ground. Let me go back real quick, and I'm sorry, this might be a little bit long-winded for you, Mel. But the idea is that the graph that we showed where we had these 170, 180 per day, but now we've dropped down. Again, that's kind of why I said that would be great if we can see that trend continue to happen, because that other modeling then would have to come down to a lower threshold of the model. So it's just so much up in the air. But I got to tell you, looking at the model for admits, it's actually kind of scary because it's following the admit upper threshold with the admits that we're seeing right now.
All right, next question is from Brooks Sutherland with The Blade. Go ahead, Brooks, with your question.
Hey, Eric, along those lines, I mean, are you anticipating an immediate surge given, how many people congregated and gathered for the Solheim Cup? Are you kind of anticipating seeing a big spike here in the near future?
Brooks, that's a great question. I think I've gotten that over the last 3 or 4 weeks, not just about Solheim. And I don't want to focus in on Solheim. I want to focus on these crowded events. Let's look at kind of what Northeast Ohio has done just with indoor events, where the theater district, from what I heard, is either wanting to have them test negative, or be vaccinated before they can get into the theaters. They're doing that to make sure, again, that they keep the risk of exposure down. A very crowded event, a theater. We're seeing other outbreaks associated with outdoor events now, just because the Delta is so transmissible. That again, we're concerned about any large scale outdoor event where you are packed in very tight. What I mean by that, front to back, it's kind of like at a rock concert where you can't move. That really kind of is our concern. I would expect any large gathering to have the possibility of a spreader event, whether it's Solheim, whether it's a football game, or an indoor venue where we're not masking. We'll see probably in the next 7 days, if whatever happened over the last couple of weekends. Don't forget, we had the German American Festival, we've had some other fairs, so those all are going to add possibly to our numbers, but we won't know until, like I said, probably the next week or so.
All right, the next question is from Emily Cohen. Emily is with Channel 11. Please go ahead and ask your question.
Hi. So after cities like Columbus issued an indoor mask mandate, is Toledo next? I know the decision is not left up to the health department, but the city of Toledo leaders are saying that they're following the lead of the health department. So we're just trying to see what you guys are thinking right now. What could happen next?
I listened to the press conference from ODH, and I think that Dr. Vanderbilt said it very well. That again, we want to have people do the right thing, and the right thing is masking up. Whether it's a recommendation or mandate, I think people really need to start looking at these numbers to say, I need to take it upon myself to be able to mask up. Because again, I applaud what Columbus did. I'm not saying that there's anything bad about it, but I think it really comes back on us that, when we go into Kroger's, we're probably most likely going to wear our mask, especially if there's a mask mandate. But in other areas where we could be also having a concern because people maybe not see us as much, we're not wearing a face covering. We need to constantly wear that face covering. But more importantly, it's getting vaccinated. Columbus was the first city to look at a mask mandate. I have a conference call with other health commissioners tomorrow throughout the state. I'm sure we're going to be talking about that. How to, what process do we use? What do we do? How do we word it? So we're going to look kind of how the executive order comes out too from Columbus, I'm sure, as a group of health commissioners, and have that debate tomorrow, or at least start that debate. Before that question, I think like the doctor and both I have said, it really is up to us as individuals to help the kids, to help the community, and help the hospitals. And again, it's when you're not being looked at is when you really should also be doing those things that we talked about: social distancing, masking up, getting vaccinated. And again, I'm pleading with the community to do those things to help us out right now, because I'm just looking at new numbers from the Ohio Department of Health of the 100,000. And, I'm looking at Pike County with 1,948 per 100,000. That's extreme. But, here in Lucas County, we're 448 per 100,000. So we're still doing pretty good. but we're still 4 times over that high incident rate. So we still need to be practicing those things that we've been talking about for so long.
All right, next question is from Brooks again with the Blade. Go ahead, Brooks, ask your question.
Yeah, Eric, I was just curious, you mentioned that we've seen a slight uptick in vaccines recently. I'm curious if you found that is due to the full authorization from the FDA, or is it that, you know, the $100 vouchers that we're doing, things like that are starting to work?
You know, Brooks, anecdotally, I'm just going to say this anecdotally from people that I've talked to who've gotten vaccinated, you know, they really like that $100 incentive card. Right now it's Kroger's, and they really like that. And they said, yeah, that's kind of what got me over. But there's been other individuals who also say, hey, listen, you know, yeah, it's been fully approved. Yeah, it's my time to get it. I said I would, and I'm going to. But there's not as many as I thought there were going to be who've said that to me, because I think as we've had these conversations before, you know, we've had many people say, well, I'm not getting it until it's a fully approved. And once it is, I will. I'm not so sure that a lot of those people have come up yet to get their vaccine, at least from the people that I've talked to. I think some too are truly concerned about Delta and, you know, what it is doing throughout the United States. And they're looking at them going, maybe I should go get vaccinated. I think a large majority of them, though, like I just said, are probably more the incentive, at least at the start when we did the incentives. Number wise too, let me just fill you in real quick. And Brooks, thanks for the lead in here. You know, 6 weeks ago or so, we were averaging, let's say, about 250, 280 a week that we were giving vaccines. When we started the incentive program, we almost doubled that, not quite, but every week except for last week, we went up 500 and then 600 vaccines per week, where last week, again, holiday week, I guess you could say, we were a little bit lower, about 400.
Okay, I don't believe that we have any other, oh, I'm sorry, one more question just came in. WAKT with 106.1. Please go ahead and ask your question.
Yeah, this is Dan Rutt. Hi, Eric. It's been a little while. Sorry, we're back in it again, but I wasn't sure when you were talking about what the state is considering as far as like a mask mandate. Did you say that the state is working up on some executive order? Or are they ruling that out? Could you just clarify that, please?
Sure. No, I'm sorry. What I was talking about was Columbus's executive order that the mayor put out about a mask mandate and how they've kind of worked that. And I think tomorrow, I'm sure during my health commissioner's conference call, we will definitely be talking about that. I think what we heard today from the Ohio Department of Health, that, you know, I don't think they're going to right now look at issuing a mask mandate. I think what everybody is saying is that you really need to do the right thing and wear your face covering. So again, I don't want to speak for state because again, I'm not involved in those conversations. But again, I really do think that we need to make sure that we press upon everybody in the community when you need to wear that face covering, because it does help us knock down some of the disease in the community.
Okay, and for further clarification, are you telling me that it's your understanding that Governor DeWine does not have any metric or any defined set of conditions where he would plan to have a mask mandate?
You know, Dan, that's a great question. I wish I was in his inner circle, but I'm not. And I don't know their plans or matrices for, you know, if they're going to offer or issue a mask mandate. I don't know that. And I'd just be speaking really off the cuff to even give you kind of an answer.
Well, I think your knowledge of it is a good indicator, a good metric for me. I mean, if a health commissioner of a major city in Toledo in Ohio does not even know what the governor's thinking, at best it's flunking communication. I'm assuming at this point that there is no metric, given the fact that there's no knowledge of such a metric. Okay, that's sad. I have a couple more questions. Going to like testing and contact tracing, which has kind of been deprioritized, it seems, in this latest round, what are the return times that we're seeing now with testing results?
I think return testing is 48 hours plus. I don't think we're up to those 5 or 6 days that we saw, you know, last year. I will tell you that, there are counties that are having some issue with obtaining tests. Here locally, I'm not hearing of any. I asked my staff to kind of do a little bit of canvassing, and I don't think that the test itself is hard to get right now. But I do believe if we go up in cases, that might change. I asked the Ohio Department of Health today, or actually yesterday, and I think we got confirmation today of those home test kits that can be proctored. We should be receiving 3,000 of those. So that will help if we need to have those in the community. But we're also going to be talking to the schools to look at the quarantine issues that they have there to possibly move those forward as well. So we're trying to plan here for the issue of testing.
Okay, so you're saying like 2 days or maybe a little more is kind of the typical?
I think so. That's what I'm hearing. Yeah.
Yeah. Okay. Now, has contact tracing been kind of ramped up? I mean, how's that going? And you mentioned that we're seeing outbreaks in the outdoors, which is a good insight. So anything else to share on that front?
Yeah, so contact tracing, what we've done is through the Ohio Department of Health, we've contracted with a company called PCG to do the bulk of our contact tracing. What we're looking at doing is bringing back some more internal ability. We have our epidemiologists, we have some surge epis, but as we plan for what might happen in the next couple of weeks, I want to make sure that we have some additional internal capabilities if we have to continue that contact tracing even further. There's some things that I think that we might want to follow up with individuals who have already been contacted to get a little bit more in-depth information. So we're trying to, again, pre-plan for a couple of things and also then gather some additional information that I think we'd like to see, such as were you at, some major events, where were you at that point in time? So we're trying to figure out how to make that happen so we can really dive down into what's happening in our community.
Okay, one last question. You talked about, sorry, I got a siren going by.
Sorry.
You hear that? Talked about vaccines as the main tool. And it looks like in the last month that we've done about 0.5% of the population each week. So that's a couple percent per month. If we were able to maintain that rate, which I'd just like your opinion, if that's even possible, but if we maintain that rate, that means we will not even be to 2/3 of the Lucas County population vaccinated by the end of April, the end of flu season. So could you just talk a little bit further? If that's our main tool, and we're going to have over the 1/3 of the population plus, at kind of as a minimum throughout the entire flu season, kind of where does that leave us?
Again, I'm going to stress vaccinations. Get your vaccine. Again, I have to keep that in the forefront because, again, like you said, that is the tool right now that will help, will more than likely keep you out of the hospital. So, and you're 100% right. I think some of the math, if you would, might have increased a little bit. I think because when we did this about a month and a half ago or so, when we had low vaccine uptake, I think we were looking at April or May. So, it's still going to be early 2022, but which month is it? We'd have to go back and really crunch some numbers and look at that math again. But you're 100% right. I mean, we're going to be going through flu season here. Now, if we remember last year, we really didn't have a flu season, but why was that? Was that because we were masked up? We were kind of keeping away from each other? Or was there a competition between viruses? And again, if you look at some of the research out there, that's kind of what they might be thinking, is that there was some competition. So flu virus really didn't have the ability to get a foothold. But I caution you, this is why, again, get vaccinated, because you only have to deal with one virus at a time, possibly, is that we see the RSV in the kids. So the competition in that virus didn't work out. So is the competition in a flu this year going to help us? Maybe not. So caution you, get your flu vaccine, get your COVID vaccine, so you're protected until we can reach early 2022, when we think we're going to have 3/4 of the population vaccinated.
Yeah, and I guess a follow-up on that. I mean, when I referred flu, I really meant coincident with COVID, since they're transmitted roughly the same way. But I guess the thing is, following the vaccinations, for months, we have trended both below Ohio, and Ohio has trended below the nation as a whole. So I'm just kind of trying to extrapolate this into the future. It looks like we're going to resemble more the South than we're going to resemble the Northeast, for instance, as far as the trajectory of this disease, if we're relying on vaccinations to be our main tool.
Well, again, Dan, great question, but don't forget, we're 51%, Delaware, I think is upper 60s, Cuyahoga County's 57. And again, I'm just throwing some numbers out where we have some other, rural communities that are 38, and we're all in this together. So, again, this is why it's so important to get vaccinated. I think here we're still going to experience issues. There's no two ways about it. But I'm hoping that our issues that we have inside the community over the next month probably won't mirror the lower instance of vaccine in some of the other counties that we have in Ohio. Because again, you just said, looking down south, where most of the issues, it's where we have very low vaccine rates, 35, 38%. Again, I'm not saying that we need to rest at 51. What I'm hoping is that 51% is going to bode well for us, in that we're not going to have the extreme issues like a community that only has 38%. Dan, if there's any way that we can, again, market more vaccine, again, we're here today talking about it. That is the true way, again, to make sure that we keep ourselves out of the pickle that other communities are having throughout the community or throughout the country.
So the pedals to the metal, eh?
Yes, it is. I think Melissa Vage said it the best, where bracing for impact a few weeks ago. I think we're getting there. We're getting there in Lucas County.
Thank you.
Sure.
All right, last question is from Brooks again with the Blade. Brooks, go ahead, ask your question, please.
Yeah, just real quick, and Eric, you may be really interested, and Dr. DeLucia can maybe jump in if she wants, but about RSV, do we have numbers on how many cases of that, and is it more that it's here early, rather than the November through April season, or do we have a real kind of issue with just the volume of how many cases?
Brooks, I'm going to again, better to hear from Dr. DeLucia than me. You've heard from me for the last 20 minutes. So Doc, could you take that?
I can try to take that. The problem here with actual numbers, Brooks, is that, again, the children's hospitals, both of them in town, do not provide you with numbers. So I talked to R.W. Mills last night, who is the chief of pediatrics at Mercy Children's, and he told me both hospitals have the same policy. They will not release actual numbers, and they won't release the diagnoses. So I have no way of knowing how much. I can tell you, though, that throughout the community, we're seeing lots and lots of kids with colds. And a lot of those colds that you're seeing in doctors' offices are also likely to be respiratory syncytial virus. The American Academy of Peds has been talking about the fact that respiratory syncytial virus has started so early, and it's so great in numbers, and we've never had something like this. RW's been practicing a little bit longer than me, and he said never in his career has he seen this much RSV at this time of year for sure. So we've definitely got an issue between RSV and COVID going on. And for me, the worst part of the whole thing is the idea that you can get a co-infection where you have RSV and COVID at the same time. That's just really frightening.
Doc, thank you so much for that. Just real quick, unless there's one other question. Again, I really want to stress this to the community is that, again, we've talked about mask wearing, we've talked about vaccinations, we talked about why. I really want us to focus in on our hospitals. We need to protect our hospitals. If nothing else, to wear a mask, to be able to protect our hospitals so they can take care of our kids, they can take care of the motor vehicle accident, so that they're not inundated, working 16 hours a day, some individuals, and trying to care for us. I'm not worried about resources. I'm worried about staff. I'm worried about our ability to, again, have our hospitals operate as they need to protect all of us in our community. So please think about the hospitals next time you go out without a mask, or you say, I can get vaccinated tomorrow. Please remember our hospitals and what they do for all of us and why we need them so badly. Shannon, unless the doctor has anything else or anybody else, I do believe that is it for us today.
Yep, I think we're good. Thank you all so much
Thanks,
for attending
everybody.
today. Have a great day.
Have a good one.